everyone, and welcome to Time with Dr. Racheal. Still on the series of uterine fibroids, but guess what? There's a twist to today's meeting, a twist to this video, and that is fibroids and pregnancy. Yeah, fibroids and pregnancy. A lot of people would tell me, oh, Dr. Racheal, so I have fibroids and I want a baby. Or I have fibroids and I'm pregnant. I have fibroids, I just had a miscarriage. I have fibroids, I just had my babies. I had fibroids and I've been bleeding and I'm pregnant. I have fibroids and I want it out. I know. So honestly, it's not easy to have fibroids and you're pregnant. Let us break it down. Let's start from how it affects you before you conceive, when you conceive, and when you're having your babies, and even after. So before you conceive, fibroids could cause, you may not be able to conceive in the presence of fibroids. And it depends on the location of the fibroids. If the fibroids are blocking the tubes, yes, it could affect your ability to conceive. Also, the fibroids stretch the womb. So if you have multiple fibroids, it increases the distance between the sperm travel and where the eggs are located. So the average womb of a woman isn't so big. It's like not so big. But with fibroids, multiple fibroids, it just keeps going boom, 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 boom. And it could be this big, and you do have sexual intercourse with your husband and the sperms travel. They're traveling. They're tired. Sometimes they don't even make it. They just die off. Where's the egg? And they die off. Where's the egg? And they die off. And guess what? The egg is not designed to leave the tube where it will be fertilized. So that's the problem. The sperm cannot get to the egg. The egg cannot get to the sperm, and then you cannot get pregnant. So we say it increases the travel distance of the sperm. Also, just because the fibroid is there, possibly within the lining of the womb, now this beautiful embryo has happened, meaning the sperm has fertilized the egg, and they're traveling back home. We're going home, and then they get home. Where's our furniture? It's all out. Where's our bed? And there's nowhere for the embryos to lie. What happens? No pregnancy. This is sad. So these are just a few things the fibroid can do to prevent pregnancy. Now we're pregnant. We crossed all the hurdles on our way. We kicked them, took out the... Yeah, I like superhero movies. I know you know that. So we took everything out. Captain America is here. Yay! We took everything out. Superman came in, rolled off the fibroids. Yes, we made it! And then they get pregnant. And then the baby starts to grow. And then like 12 weeks, you have a miscarriage. Because the fibroid has not only sat on parts of the place where the baby should grow into, it has reduced the blood supply to the embryo. And so where the baby is lying is not healthy enough. The embryo, the fetus, doesn't have a healthy enough location. So it slops off and dies, reduced blood supply, and miscarriage. A weeping womb, yeah. So fibroids could do that. Now, this baby says, I'm gonna make it, whatever it takes, and then the baby stays in. Like, I will stay here and I will grow. Guess what happens to the fibroids? Pain. Because now the blood supply to the fibroid is reduced. And the fibroid is not getting enough of what it should get. So because something like red degeneration, the fibroid would now be so painful. You would just see a pregnant woman, it could just be going like that. And then, sharp pain, what happened? Or the fibroid starts to make the womb contract, like you're having some contraction, and due to this miscarriage or due to this excessive pain, lower abdominal pain going to the back, and this pregnant woman is just going through so much, fibroid. Sometimes, there are lots of things we can do to help with this. Give you pain relief, lots of rest, lots of hydration. All of this works. Relaxing, trying to improve your blood levels, eating healthy. All of this can help. However, if you do get through all of this phase, and now it's time for us to have our baby, because the fibroid has decided to sit at the lower part of the womb. So what happens to the baby? The baby decides that there's no space for me to do. The baby sits on the fibroid, and then we have abnormal presentation. That means that the baby is sitting, what we call bridge presentation. In Arabic, they will say baby jalis. Baby is sitting down. Now this baby sits down. And so, obviously, if it's your first time pregnancy, it's a cesarean session most of the time. And if not, if the fibroid has decided that we own the basement, you can only stay on the upside of the house, then what happens to you and the baby? You need to have a cesarean session. That's an operative delivery. That means you have an operation on your tummy and your womb to get out the baby. So fibroids can do this. Also, just because the fibroids are there, even if they are not at the lower part of the womb, they could cause what we call abnormal labor. You're just having labor. So in labor, yes, I like what I do. So in labor, when you have pain and you feel pain, it's like an electrical activity, like from the fundus, that's from the top of your womb, the contractions go boom, boom, boom. Contractions, nice reading. But with fibroids, maybe you're supposed to be having contractions, boom, it shuts it up, boom, boom. So it's not good enough. So we call it a dysfunctional labor. And if you don't have regular contractions, there is no way you can have your baby continue to descend and the cervix, which is the mouth of your womb, to open up and eventually have a vaginal delivery. So you may still have an operative delivery. That means you may have a cesarean session. Are you with me? So you see, these are the different things that fibroids can do in pregnancy. Now we've made it. I'm gonna make it. And then you made it to labor, delivery, you had your baby. But because you had fibroids, now your womb refuses to contract. And you start to bleed after delivery. What we call postpartum hemorrhage, when you continue to bleed even after you have delivered the baby, even if you had a difficult, you have delivered the placenta, even if you had no tear or you had a tear was repaired, and then a woman continues to bleed. The doctor gives you everything. The nurse and the midwife gives you everything you need to get. You just continue to bleed. It could be so bad that you may have to lose your womb. However, there are many things that we can do to prevent this. We preempt that, you have uterine fibroids, you may bleed. So there are certain things that we do already proactively. And so if you have uterine fibroids and pregnancy, my advice is that you deliver in a hospital that has all the necessary facilities and the personnel. Are you with me? And if you happen to be far away from that hospital at delivery, you need to let them know early enough so that if they need to send an ambulance to get you to monitor you after delivery and all, it's very important. So these are the things that could happen when you have fibroid and pregnancy. This is just to tell you, like, chief of the complaints. But if you want to hear more from us, you like what you're hearing, or you've experienced anything about fibroid and pregnancy, please drop it in the notification in the comment section. Tell us your experience, and we would be happy to, talk to you about it. And you could turn on your notification button so that if you have more videos like this, we would be happy to give to you. And also subscribe to our channel and like our comment. Till then, we'll see you later. Bye for now. Time with Dr. Racheal.